Good day. This is the Professor, CBMD PhD. And today's Sunday, March 26, 2023. It is 2:03 and 56 seconds, p.m. Eastern Standard Time. And today's research, bone pathology. So let's hop to it here. Researchers ask, is bone health linked to brain health? Date March 22nd, 2023. Source, American Academy of Neurology. As people who have low bone density may have an increased risk of developing dementia compared to people who have higher bone density, the study does not prove that low bone density causes dementia. It only shows an association. Low bone density and dementia are two conditions that commonly affect older people simultaneously, especially as bone loss often increases due to physical inactivity and poor nutrition during dementia. However, little is known about bone loss that occurs in the period leading up to dementia. The study found that bone loss, indeed, already occurs before dementia and thus is linked to a higher risk of dementia. The study involved 3,651 people in the Netherlands with an average age of 72 who did not have dementia at the start of the study. Over an average of 11 years, 688 people, or 19%, developed dementia. Researchers looked at X-rays to identify bone density. Participants were interviewed every 4 or 5 years and completed physical tests, such as bone scans and tests for dementia. Of the 1,211 people with the lowest total body bone density, 90 people developed dementia within 10 years, compared to 57 of the 1,211 people with the highest bone density. After adjusting for factors such as age, sex, education, other illnesses, and medication use, and a family history of dementia, researchers found that within 10 years, people with the lowest total bone density were 42% more likely to develop dementia than people in the highest group. As previous research has found, factors like diet and exercise may impact bones differently, as well as the risk of dementia. The research has found a link between bone loss and dementia, but further studies are needed to better understand this connection between bone density and memory loss. It is possible that bone loss may occur already in the earliest phases of dementia, years before any clinical symptoms manifest themselves. If that were the case, bone loss could be an indicator of risk for dementia, and people with bone loss could be targeted for screening and improved care. A limitation of the study is that participants were primarily of European origin and aged 70 or older at the start of the study, so these findings may vary in different races, ethnicities, and younger age groups. And this is the Professor of Microbiology, Bioinformatics, and Pathophysiology. This video was created for educational purposes only. Hope you enjoyed listening. Until next time, have a great day.